Hello everyone. Today we are going to discuss a very important and frequently asked topic in a surgery, that is the classification of the suture material. So firstly, what is a suture? A suture is a material used to approximate the tissues and promote healing after a surgery or an injury. So now we start with the classification of the suture material. So the suture material can be classified into three main ways. First, according to the origin of the material. Second, according to the type of the filament used. And third, according to the absorption property of the suture material. First, according to the origin material of the suture. The first class is it is subdivided into two types: natural sutures and the synthetic sutures. Natural sutures are derived from the natural sources, and the synthetic sutures are derived from the synthetic sources. Firstly, the natural sutures. This example of this are the catgut suture and the silk suture. So, for further information, catgut is derived from the animal intestine, and silk is obtained from the silkworm. The example of the synthetic sutures are proline, vicryl, and the polydiaxone. They are synthetic, so they does not cause that much tissue reaction when are used. The next mode of classification is according to the type of the filaments. According to the type of the filaments, they are classified into two subtypes: monofilament and braided or the multifilament type. Monofilament sutures consist of a single strand. The example of monofilament sutures are catgut suture, proline, nylon, monocryl, and the polydiaxone. Whereas the braided suture are made up of the multiple strand braided together. The example of the braided sutures are the vicryl and the silk sutures. The third mode of classification of the suture is according to their absorption property. According to their absorption property, they are divided into two subtypes: absorbable and non-absorbable suture. Further, absorbable is also divided into natural and synthetic subtypes. Similarly, non-absorbable is also divided into natural and synthetic subtypes. Now, starting with the example of the natural absorbable sutures. These are the chromic catgut and catgut sutures. The absorbable synthetic sutures are monocryl, vicryl, and polydiaxone. Now start with the non-absorbable sutures. So the natural non-absorbable sutures is silk, and the synthetic non-absorbable sutures are proline, nylon, steel suture, and the polyester. So now let us start with some of the properties of the natural unabsorbable or the absorbable sutures. So the natural sutures are, as we know, natural in origin. So they may contain some antigens that have high tendency to cause inflammatory reaction at the site of the suture. The next is the dissolution of the suture. So they dissolve by proteolysis. The dissolution time for catgut suture is approximately 7 to 10 days, and for the chromic catgut sutures it is about 90 days. So now let us start with the synthetic absorbable sutures. So as we know, synthetic absorbable sutures are made up of synthetic substances, so they do not produce any kind of antigen, or they are made up of the inert or unreactive material, so they causes very less inflammatory reaction. The next is the dissolution of the suture. So the synthetic absorbable sutures dissolve by hydrolysis of the material. First is the monocryl suture, which hydrolyze in the 90 to 120 days. Second is the vicryl suture, which hydrolyze in 60 to 90 days. And the third is the polydiaxone suture, which hydrolyzes in the